Who has ever experienced an intense and persistent migraine headache that has lasted over a week? Well, did you know that this is a common feeling associated with concussions? Concussions may not seem like a serious injury at first, but they can develop into becoming more frequent and serious if not cared for properly. I received one my junior year in high school playing hockey, and since then I have had two more. Patients may not care for their concussions properly because they may see it as just like a headache or something, but it can stem into something worse. Today I would like to explain what a concussion is, some side effects, and some statistics on sports-related concussions. Knowing about concussions is important because if you or someone you know receives one, you can know how to react. So a concussion is a form of mild traumatic brain injury, which happens whenever there's a blow or hit to the head. And David Mennon, a professor at the University of Cambridge, wrote in 2015 that when the brain is pushed against the inside of the skull, it can become bruised. Some nerve fibers can recover from such injury, but more severely injured nerve fibers can permanently lose their ability to send signals and communicate with others. So some side effects that are related to this are headaches, dizziness, sensitivity to light, and some more serious problems, if not cared for properly, can stem, such as psychological problems including memory loss, depression, and anxiety. So if you do suffer a concussion, it is very important that you care for it properly. It is recommended that 3 to 5 days of mental rest is taken, so no physical activities, even television. And if mental strenuous activity is continued, it will take a lot longer to recover and you're more susceptible to concussions. So now I'd like to talk about concussions in sports. It is estimated on average that 2 to 3 million sports-related concussions happen annually in the US. And according to headcase.com, a study conducted in 2012 found that 1 in 5 high school athletes received in-season concussions. The three most sports related to this were football, boys ice hockey, and girls soccer, with 70, 50, and 30 per every 100,000 athletic exposures. And they defined an athletic exposure as any time the players were in a practice or game situation. And it's important to know that these can actually be prevented by wearing proper equipment and players knowing good sportsmanship. Concussions have a rise lately in pro sports as well, especially in the NFL. According to Chief Medical Correspondent Dr. Sanjay Gupta, that over 90% of former NFL players have developed chronic traumatic encephalopathy, also referred to as CTE, which is a progressive degenerative brain disorder that develops after repeated blows to the head. It can cause early dementia in patients, typically at age 40 compared to age 60, personality disorders as patients become more aggressive, and it can lead into patients committing suicide in some very serious cases. So concussions being such a common injury, it is important to know that they can be cared for and prevented properly. They can occur at any age and in any sport or recreation. So playing smart and safe is very crucial. And remember, the next time that you participate in your favorite activity, that hit to the head is a lot more serious than just getting your bell rung.